Freedom and solidarity for the people of Palestine. Following 16 years of siege and conflict, attacks on healthcare resources continues to intensify in the Gaza Strip. According to recent stats from the World Health Organization, over 200 healthcare workers have been killed on the West Bank and Gaza.
And what people don't know is that the Israeli army systematically goes after healthcare. And they've always done that. I've been working during the bombardment in 2006, 9, 12, 14. I've been in the West Bank. I was there during the Intifadas, and I was in Beirut in 82. And it's the same experience. They target healthcare. They don't need the excuse they were trying to construct for Shifa. It's a command center. If you look at the latest statistics from WHO, when this attack started, they have 36 hospitals in Gaza. When it started, 34 of them were partially unfunctioning. 2 were not functioning. And then they were, attacking. And by the end, on the 14th of November, the picture was upside down. There were 8 remaining out of the 36 partially functioning and 28 non-functioning, closed. So this is not about Shifa. This is not about some command center. This is to try to hide the fact that the Israeli army are eradicating the Palestinian healthcare, not only the hospitals, the ambulances, the primary healthcare, which is very important for 2.2 million people.
Since the attacks began in early October this year, Gaza has seen massive poverty, economic collapse, and the dire need for medical supplies. Out of the 12,000 Gaza fatalities, 6,000 are reported to be children.
Anyone in Gaza today who is younger than 16 years have been under siege their whole life. And they've had 5 major attacks on their lives and their neighborhood and their school and their family and their whole life before this. And now comes this massive attack with 6,000 killed children and their siblings, watching them being killed or being injured themselves. So this is the biggest assault, this is the biggest crime against a pediatric child population in history since actually the Old Testament.
Dr. Gilbert says, having witnessed the challenges faced by the people of Gaza, he is determined to debunk misconceptions and reveal the harsh realities on the ground. A call for an immediate and long-term ceasefire.
It's to stop the killing. That means immediate stop in the bombing, immediate long-lasting ceasefire. This cannot go on. And number 2, open Gaza. Let relief in. Let 600, 700, 800 trucks per day in, under international control, not under Israeli control. And that's also part of international law, that corridors of supplies and corridors of relief shall be controlled by the United Nations.
The World Health Organization says over the next 24 to 72 hours, pending guarantees of safe passage by parties to the conflict, additional missions are being arranged to urgently transport patients from Shifa Hospital to Nasser Medical Complex and European Gaza Hospital in the south of Gaza. Lwando Nomoyi, SABC News. Aber.